Diane. Diane, I know our tech team has probably sent you a message to unmute, so if you would go do that now. Thank you.
Do any of your protocols have any effect on controlling paroxysmal atrial fibrillation?
Yeah, that's a great question. So we're actually looking at the next study we're going to do is we're going to look at arrhythmias in general. But the answer is what we've seen anecdotally in our clinical setting is that atrial fibrillation is better controlled in the setting of a defined plant-based diet. And part of the reason why is that atrial fibrillation is not just a disease of the heart and heart rhythm. I'm a cardiac electrophysiologist. I used to do atrial fibrillation ablations years ago. And I remember when I started doing ablations, I would take relatively young patients, early AFib, and we'd go and isolate the pulmonary veins, and they come out, they do fine. But I noticed over time those patients would go back into atrial fibrillation. I know one of my colleagues years ago, they had done studies when they looked at young patients without heart disease. They did integral electrical mapping, 3D mapping of the atrial chambers, and they saw lots of patch scarring. And these are relatively young people who had not had surgeries or the like. And they had early forms of atrial fibrillations, or what was thought to be multifocal atrial tachycardia. And so they would do little ablations and connect the patches and get rid of the atrial fibrillation. But I think these individuals would also go back and have more atrial arrhythmias later on. So putting all that together, atrial fibrillation is sort of a multiple set of diseases, and inflammation is one of the things that I think is contributing, drives that. And we do know that there's high electrical signals coming from the pulmonary veins. That's why the pulmonary vein ablations help. But these individuals have lots of inflammation and metabolic and biochemical imbalances. And we know that the people that do worse with atrial fibrillation are people with chronic illnesses such as heart failure, hypertension, hyperlipidemia, vascular coronary disease, diabetes, and the like. And when we get rid of these comorbidities, that decrease their risk for stroke and so on. And so the nutritional approach, which, by the way, the data has been found to be most successful in treating atrial fibrillation is diet and exercise. So the nutritional approach that we take, we know decreases this underlying oxidative stress and inflammatory mechanism for atrial fibrillation, and it allows patients to stay in sinus rhythm longer. So what we see clinically is a patient with severe heart failure, long-standing atrial fibrillation, chronic AFib, the AFib that you think will not be converted. We'll put them on a low-dose antiarrhythmic medication for atrial fibrillation. We'll put them on a raw detox diet. We'll then cardiovert them. We'll then bring them back. They stay in sinus rhythm for a sustained period of time. We're able to wean the antiarrhythmic medication down to almost nothing. In some cases, nothing. If they stay on the nutritional regimen, we've had good success with that. We're going to look at some data to try to substantiate what we've seen clinically.
Thanks, Dr. Montgomery. And up next, we have Gregory. Gregory, you are up.
Hi, thank you, Doctor. Enjoyed your presentation. I was wondering, have you, I know it seems like you are more of a heart specialist. I was wondering, have you had any patients that have osteoarthritis? Have you worked with any patients, and do your interventions, your detoxing work for osteoarthritis pain? And not only that, maybe possibly increasing mobility and maybe patients that can maybe go from walking to being able to run again?
Yes, sir. That's a great question. And, our heart failure patients come in with more than just one thing. They usually have a basket load of chronic illnesses, and most people come in with chronic diseases. But to answer your question, yes, we see lots of patients with chronic arthritis. We see arthritis of different types. We see lupus, we see rheumatoid arthritis, we see, osteoarthritis. And to your point, yes, our patients get better. We start them off on an aggressive detox. Sometimes we may add a liposomal curcumin along with it or not. But we find for the most part, within a week or two of aggressive detox, they start to feel better. One patient I saw just a few days ago, and she was talking about how her joints were feeling better. And I think she was on week 2, and she says, seemed like somebody oiled my joints. But we do see a significant improvement in their overall well-being. And the arthritis goes away. We actually have patients who go from wheelchair to the cane, to the walker, to walking without a walker. We even have an on-site fitness program with a trainer We actually have them go outdoors and they take out their shoes, they do grounding. So there's fresh air, sunshine, these things I didn't get into in the details of my talk. But in addition to the nutritional regimen, we treat our patient with these disabilities in a more global approach, and we've had good success with that.
Thanks, Doctor. Up next, we have Steve. Steve, I believe our tech team has sent you a note to unmute.
Hello, Doctor.
Hi, Steve.
It's great to talk. Thank you so much. Particularly cardiosarcoidosis, being treated with low-dose methotrexate in a young man, and just wanted to know if you've had any experience with this.
Yeah, sarcoidosis, we have a number of patients we're treating with cardiac sarcoidosis, and it's a very complex disease to treat. It's an infiltrative cardiomyopathy. It's a chronic inflammatory condition. It affects the lungs and the heart and other tissues. And so really many individuals with cardiac sarcoidosis have multi-organ dysfunction. You know, I've had some with just primary cardiac sarcoidosis, but what we've done is by reducing the inflammatory load and reducing oxidative stress, we've had success in reducing inflammation. And so oftentimes these individuals are treated by other specialists, endocrinologists, rheumatologists, and frequently what we've seen is that the medication requirement for inflammation, the steroid use and the like can be either heavily reduced or eliminated when they're treated in an aggressive fashion. Sometimes it takes longer. They need to be treated in a more aggressive regimen. Some of these individuals may have to do a juice feast. It just depends on their tolerance and compliance with the regimen. But individuals who are able to tolerate a longer detox regimen do better. Sometimes we'll add the adjunct of MSM, the methylsulfonyl-methane, to reduce inflammation, oxidative stress. I had a patient with sarcoid lung and heart disease. She had some inflammation. She had an atypical tuberculosis infection in her sarcoid lung, and in addition to the sarcoid heart, she has a defibrillator. And we treated her aggressively with diet as well as supplements, and we avoided antibiotics and treated the tuberculosis. So the patients with sarcoid heart disease typically have many other dysfunctions, and they often have other things that we have to treat. So they're more complex, but the answer is yes, we've had good success. And I would even argue that patients with the more complex illnesses, such as sarcoid cardiomyopathy and sarcoid lung disease, really benefit from this, because a nutritional detox cuts across all these areas and reduces oxidative stress, and it makes managing these patients easier. And so that's been our experience.